The tips I would give general practitioners or colleagues when it comes to suturing is practice and practice and practice. The most important aspects of suturing is to know what suture to use, what type of knots you should be doing, where you should be placing your actual needles, and how you hold them and how you perform your ties. The experience comes from knowing tissue and knowing how much tension to apply to sutures. But the most basic thing to do is to learn the basics of knot tying. Do not stray from surgical knots. Always use surgical knots and practice it to the point where you can do it with your eyes closed. And always understand that needles are fine instruments but robust at the same time. And when you are piercing skin, always pierce first before you rotate your needle. That's one thing that I see delegates do, say, in our workshops, where they are complaining about needles getting bent a lot when they're performing their suturing. The most common reason for that is you are actually turning the needle too soon before you actually pierce the tissue. So pierce the tissue and it will turn naturally and it shouldn't bend. And the other thing is to know your knot tying and know the tension that you apply in order to get a good everted wound line, which means you get the best possible cosmetic scar. And everything about suturing is not just what you're doing there and then. There is the preparation for your suturing, which involves preparing your patient. Make sure that your patient knows exactly what you're about to do for them. Make sure that they know how to look after the care of your wound properly. Because it doesn't matter how nicely you've sutured a wound. If your patient hasn't bothered to look after it properly as instructed, it all comes to nothing. And not only that, the minute your beautiful sutures are removed, the wound in the end will only heal well as a scar if they look after the scar as well. So suturing and tips for suturing is not just about the suturing, it's about how you prepare, how you do it, and what happens afterwards. It's all part of the wound care for you to get the best possible outcome. And use proper sutures for different parts of the body according to how it should be used. Do not use coarse suture material for, say, very cosmetically sensitive areas like your face. You avoid using anything but 6/0 nylon for the face. You avoid anything beyond 6/0 nylon, you will do better. You don't want to use 6/0 nylon on the back. If you do that, you are asking for trouble. So know your sutures, know where to put them, know what body part is indicated for the suture, and you will do a lot better.